These days, it can be hard to trust the media. What's true, what's fake, and who is behind the message? I'm a freelance journalist and videographer who has spent years studying the media. Now I'm taking a look at what local, regional, and national news stories mean to us here in North Central Washington. I'm Dominick Bonny, and this is Common Sense. Hello and welcome to Common Sense. I'm Dominick Bonny, and in this episode, we're going to drop in on one local woman's first vaccination appointment in Wenatchee and hear why she decided to get the jab. Then we'll catch up with Dr. Mabel Bodell in Kashmir outside a vaccine information and outreach event at Crunch Pack and talk about vaccine equity and her efforts to reach Latinx folks in our region with culturally appropriate and well-vetted COVID-19 information. Because the fact is, you can translate something from one language to another and still totally miss the mark, right? I mean, for those of us who took a foreign language class in high school and then visited that country, you understand the limitations of a very rudimentary understanding of the language you're trying to communicate in. It's important to understand the culture and not just the language of the people you're trying to reach. That's why outreach efforts like what Teresa Bendito and the Madrinas de Salud group are doing are so important. They are reaching out to the Latinx community in culturally appropriate ways, building trust and relationships with the folks they are trying to reach. It's just one response to what in earlier this year looked like an alarming trend, vaccine doses going disproportionately to white Washingtonians. According to the Seattle Times in February 2021, quote, the Times analysis shows Washington has some clear gaps. While 67% of people who received their initial doses were white, 48% of the state's COVID-19 cases, the illness caused by the coronavirus, has been in white patients. On the other hand, Black and Hispanic residents have been comparatively under-vaccinated. Just 5% of people receiving an initial dose were Hispanic, while 32% of people who have tested positive for the coronavirus have been Hispanic, end quote. Now, that was in February, and because of those troubling trends, time, effort, and resources have been dedicated to vaccine equity. Vaccine equity simply means equal access to life-saving vaccines regardless of race, income, or geography. We'll talk more about vaccine equity and outreach efforts with Dr. Bodell later in this episode, but right now, let's meet Beatriz and learn why she decided to get her first dose of the COVID-19 vaccine last week.
Okay, alrighty. So Beatriz, this is your card. I'm gonna have you bring it next with you. Come with your next vaccine, bring that with you and put our other sticker over here.
Que a la siguiente vez que regresen le van a que traiga esta tarjetita y le van a poner su otro sticker ahí también.
Is this arm okay today?
Ese brazo es en el que le van a
And this
vacunar.
is your first shot?
Esta es su primera vacuna.
Okay.
Sí.
So the side effects for your first shot could be just localized arm pain.
Lo que puede sentir después es que le pueda doler el brazo, especialmente donde la vacunan.
Taking Tylenol is okay, but don't take ibuprofen or Advil.
Lo que ya sabía que puede tomar Tylenol, pero no tome ibuprofen.
I just suggest that you just kind of take it easy today. Be aware that you have a shot in this arm and just kind of give it a rest. Don't do too many chores.
Ella sugiere que el día de hoy se la lleve muy leve y que se descanse.
You don't have to cook dinner tomorrow.
Que no cocine mucha comida. Hey, she's a really great cook.
Sorry for the family. Okay, I'm just going to clean here.
Ahorita va a limpiar y recuerde de tener el brazo flojito y cooperando, como dice. Eso va todo.
And so for now, just to make sure that we don't have any reactions, any allergic reactions, we're going to have you pull up over here and we're just put a time on your windshield. When 15 minutes is up, if you feel okay, you can go.
So how, Beatriz, how are you feeling now that you had your first dose?
Que ¿cómo se siente usted ahorita ya que recibió su primera vacuna?
Me siento feliz.
She feels happy.
Feliz porque sé que ya comencé mi protección contra el virus.
She's happy because she's now starting to have protection against the virus.
And are you worried about any side effects or, feeling down and out or anything like that?
¿Usted se teme de tener reacción después, reacciones después o algo así?
No, yo vengo con mucha fe.
No, because she comes with a lot of fe. Oh my goodness, in English, fe means
Vengo con confianza. Vengo
she's
confiada.
confident. She has a lot of confidence that this is the right thing.
Y así deberían de venir todas las personas sin miedo, porque es para un bien de nosotras mismas.
And that is how all people should come, without fear, because this is for their own good.
Yeah, well said. Did I ask, I'm not sure if I did, how are the other folks in your household vaccinated?
Que si las otras personas en su casa también están vacunadas.
Mi muchacha ya está vacunada y mi otra hija está mañana.
Okay.
Ya.
So, so she has 3 daughters, and one is too young. She cannot get vaccinated yet. One has already been vaccinated, and the other one will be vaccinated in the next days to come. Tomorrow, she says.
Wow.
Y la más chiquita tiene 10 años, no hay ahorita para ella.
And so the youngest one is 10 years old, so it's not available to her yet.
You know, what would you like the public to know about, I guess, your decision to get vaccinated today?
¿Qué le gustaría decirle al público, al público, sobre su experiencia el día de hoy o por qué se decidió vacunar? ¿Qué le quiere decir al público?
Yo quisiera decirles que no tengan miedo, que se animen a vacunarse, porque si ellas miran todos los casos que están saliendo positivos, y evitaríamos muchos casos evitaríamos llegar al hospital, o tal vez si nos da el virus no nos daría tan fuerte, pero que se animen por ellas, por nosotros y por toda la humanidad.
She wants them to know, she wants to encourage the community to get vaccinated, to not be afraid. This will help our hospitals see less people who are sick with COVID, and in the end it'll help themselves and humanity.
Yeah. Que no esperemos a que un familiar se nos enferme o a ver las personas cómo sufren. Mejor ahorita estamos a tiempo, y por qué no hacerlo.
To not wait until someone in our household is sick or suffering. Right now is the right time to get vaccinated.
Well said, definitely.
Muy buen dicho, dijo. Sí, definitivamente.
And I want to also say that I think it's commendable that a lot of people sometimes need to see somebody who they love or know suffer from COVID before they decide to get vaccinated. So just your ability to recognize that I want to do that before I see somebody in my household or my family get COVID, I'm going to take this step. That's commendable.
Dice que él como básicamente se quita el sombrero a usted, porque mucha gente desafortunadamente está esperando hasta que conoce a alguien que se enferme, que ya luego se quiera vacunar o se decide vacunar, y que dice que pues que se quita el sombrero para usted, que se decidió vacunar sin que alguien más sin ver a alguien más cerca de usted ahorita que está enfermo.
Sí, y quisiera que así las demás personas que pensáramos todos no nada más en uno, pensáramos en las demás personas, porque no nos enfermamos nada más nosotras, enfermamos a las que están a nuestro alrededor.
And so she wants to remind that people that we must be thinking about just not ourselves, but other people, because at the end of the day, we won't be the only ones to get sick. We will get others sick.
Yeah, absolutely. What about the Delta variant? Are you concerned with that? Do you know much about it? And the second part of that question would be, when the booster's available, would you get that?
que sí ha escuchado de la variante, la Delta, y que si eso le ayudó a hacer una decisión para vacunarse, y que si cuando esté disponible una vacuna que sea como de refuerzo, que si usted recibiría esa también.
Yo la recibiría con mucho gusto, y mientras sea para protegerme a mí y proteger mi familia y poder proteger a quien se acerque a mí, lo haría una y todas las veces que se ofrezca.
Aww. She's saying that she would definitely get the booster once that is available to protect herself and all of those around her. Yeah.
And you know, some people say, well, if the vaccine it has emergency conditional use. It doesn't have final FDA approval. Is that something that has factored into your decision or even something that concerns you?
So, mucha gente, como ya sabe que esta vacuna ahorita está aprobada para el uso inmediato o de emergencia, porque pues estamos en pandemia, mucha gente por esa razón no ha querido vacunarse porque dicen quiero esperar, que si eso hizo una diferencia en usted hacer su decisión para vacunarse.
No, pues yo digo que si sabemos que la vacuna la vamos a ocupar, ¿para qué vamos a esperar? Es mejor, sabemos que nos la vamos a poner, sabemos el riesgo que nos espera si no nos la ponemos. Entonces es mejor ahorita y que nuestro cuerpo esté protegido para cuando nos quiera atacar el virus, pueda rechazarlo, el cuerpo, nuestro cuerpo.
So, she knows that this vaccine is effective, and that is why, and that we know the risks that we face if we don't get vaccinated, and that is what she's mostly focusing on the fact that she knows the risks of not getting vaccinated, and so even if she is vaccinated and does get in contact with somebody who is sick with COVID, or she herself gets sick with COVID, she won't have the same reaction, she won't have the same symptoms as she would have if she wasn't vaccinated.
Sure, absolutely. Yeah. Great answers. I mean, those are pretty much all my questions. The last question I always have is there anything that we didn't cover that you want to talk about, that you want the public to know?
Sí, esas son sus preguntas, pero él siempre le gusta hacerle una última pregunta, de que si hay cualquier cosa que usted quiera que el público sepa o quiere comentar sobre algo específico que no cubrimos.
Me gustaría que el público supiera que estamos en una pandemia y que nos pongamos a pensar que la pandemia puede arrebatarnos a nuestros familiares y que está en nuestras manos poder evitarlo.
She wants to remind the community that we are still in a pandemic and that we have in our hands the ability to avoid that our loved ones and family members get sick.
Yeah, absolutely. And there's 620,000 Americans that aren't here that were here 18 months ago because of this, so we need to take it seriously.
Y que hay más de 600,000 americanos que no están aquí el día de hoy porque por lo mismo de COVID, y que tenemos que tomarlo en serio, dice. Sí. Dice que está muy de acuerdo con usted.
Sí, porque la pandemia, esto no es un juego y mucha gente lo tomamos así, como esto va a pasar, pero si nosotros no ponemos de nuestra parte, esto va a aumentar.
So a lot of people see this as something that isn't as serious, but if we don't do our part, it's just going to continue to get worse.
Yeah.
Sí, exactamente. Pues
Well,
muchas gracias.
Thank you. Yes, muchas gracias. Thank you so much. This was great.
Sí.
Good job, and thank you, Teresa.
Yes.
You know, always for everything that you're doing.
Oh,
You know,
thank you. Yes,
this is just
absolutely.
one part of it.
One part of
Yeah.
it, yes. Well, I don't know if you had any more specific questions about the whole...
Not really,
how
those were my
things-
questions, yeah.
Okay,
Yeah.
how things flowed, but yes, so we're continuing to do the outreach with those that we don't know, but also with the ones that we do know and that need that extra support, that need extra help with removing of barriers and talking about what are the local and real information that's happening, getting them what is true for them to make an informed decision, recognizing that with some folks it will take months and some folks were ready when the vaccine was available. So we're grateful to be able to spend this time though with our community and ensure that people can make that informed decision and that we're helping them along that way.
Absolutely.
Yeah.
How can people support this?
Well, what we ask for people to support is by just talking to their own family members, with their friends, with their young adults about their own experience in getting vaccinated, why they are getting vaccinated. At the end of the day, we have a great support from the Confluence Health Foundation, but we need, and we can be out doing this work, but we need everyone really to be putting their part in helping support and spread this message. So,
Absolutely.
yes.
Yes. Well, thank you so much for this opportunity.
Dice que muchas gracias.
Stay tuned after the break for more.
Introducing Alpine Airman. Because every home needs a superhero to eliminate poor indoor air quality, send inefficient operating equipment packing, and cut high energy bills down to size. For heating or cooling and equipment replacement, turn to the experts and the superheroes at Carrier and Alpine Air. We offer the best deals on high-efficiency Carrier products, along with friendly, knowledgeable service and incredible savings to fit your budget.
Dr. Divis is proud to announce that Dr. Taylor Pedigo has joined the Wenatchee Dental Arts team. After much research, Dr. Pedigo chose Wenatchee Dental Arts as the place to practice and Wenatchee as the place to live. Dr. Pedigo is an honors graduate of the UCLA School of Dentistry and has made our valley his home. Wenatchee Dental Arts offers complete comprehensive dentistry from routine teeth cleaning to sedation dentistry. Wenatchee Dental Arts now offering 2 dentists to serve all your dental needs. Call for your appointment today.
Your search for quality patio furniture with excellent customer service is over. Blue Lagoon is proud to offer only the finest outdoor furniture and accessories from some of the most renowned manufacturers in the industry. Our showroom showcases a large selection of in-stock furniture, fire pits, umbrellas, cushions, and outdoor accessories. Our in-house outdoor decor specialist is available to help you design and custom order the perfect furniture for your unique space.
At Wenatchee Power Sports, we proudly offer the Polaris product line. Polaris builds the highest quality side-by-side in the industry, with off-road capability that's second to none. The Polaris pre-order program allows customers to purchase the vehicle they want without having to select from limited dealer inventory. The Wenatchee Valley has year-round access to some of the best ORV trails in the Northwest. Start your adventure here at Wenatchee Power Sports.
Hello and welcome back. One of my journalism professors in college would always say that the way you tell a big story is focusing on an individual. And I hope you gained some insight into the bigger story of vaccine equity and hesitancy through that interview with Beatriz and Teresa. Now let's go to Kashmir, where I met up with Dr. Mabel Bodell with Confluence Health outside Crunch Pack, where she was participating in a vaccine outreach clinic. Dr. Bodell, please tell me what we're doing here today, what you're here to do in Kashmir at Crunch Pack.
So I'm Dr. Mabel Bodell. I'm a physician at Confluence Health and a huge advocate of vaccination. So we are here today at Crunch Pack to try to give information to all the employees. So through some of the outreach efforts that we are doing with Parque Padrinos, one of our grassroots organizations, they figured out that only 25% of the employees are actually vaccinated against COVID-19. So we wanted to be sure that they have the right information to make the right decision. As we said before, currently, today, August 17, we have 33 patients admitted to Central Washington Hospital with COVID-19. 13 to 16 of them are critically ill, on the verge of needing a machine to be able to breathe. And too many of them are young and actually quite healthy. So that's really sad and scary to see so many young people admitted to the hospital currently. And 100% of them are unvaccinated. 100% of them decided, for different reasons, not to get the vaccine. This is a preventable disease. We cannot wait any longer.
Yeah, well said. So what did you just get finished doing? You said this was your third visit here to Crunch Pack.
Actually, this is the first visit.
Oh, it's your first? Okay.
This is the first visit to Crunch Pack, and usually takes a couple of visits to be sure that everybody gets all the information that they need.
So you just gave a speech to the workers in English and Spanish, and why is that important to reach these people in their workplace and also bilingually?
First of all, the message should be done bilingually to be sure that the information is available in their native language. Despite the fact a lot of information has been translated, it's not the same as speaking the same language of the patient or whoever you wanted to reach regarding vaccination. You wanted to be sure that the information is clear, and they, again, if they have any questions, that you're going to be able to answer them in their native language.
Yeah, and culturally appropriate, right?
Yes,
Yeah.
and culturally appropriate.
Yeah, exactly.
Thank you, Dom.
Yeah. So, you know, this is going into the topic of vaccine equity. What does that mean, and why is that important?
So when I heard that, what you mean that is vaccine inequity, if the vaccine is free, anybody can get it. Well, yes, the vaccine is free, but initially the information was only available in English. Okay, no problem. We translate the information in Spanish, then that's it. There is no inequity. Well, at the very beginning, I don't know if you remember, that the way to access to some of the sites for vaccination, they were done through internet. Many of my patients, they don't own a computer, they don't have internet at home, they don't have even a smartphone. So how they're going to access the vaccine the same way that some other person has, all these possibilities available at the palm of their hand. So that's part of the inequities. So then we knew very well that we needed to reach some of the, for example, Latinx community members in different ways. We needed to save some spots for them, for the ones that they don't own a smartphone, for the ones that don't have internet at home. We needed to get them to the site of the vaccination site for them to get the vaccine. This is what it means, trying to really pass and break all the barriers to get to the vaccine.
Yeah, absolutely. And this isn't, the outreach to the Latinx community is just one thing. I mean, you see what is happening in Okanagan County. There's maybe folks who want the vaccine but don't have transportation.
Yes.
They don't have reliable way to get there and get home. And you see people like Ray Eckmeyer and the Lake Chelan Community Hospital. That part of what their vaccine outreach is just getting people to a vaccine site and back. You know, that's vaccine inequity being addressed by his crew. So this is a way that you're addressing vaccine inequity to a specific group. So, you know, kudos to you for that.
Correct.
Is there anything else that you would like the community to know about what you're doing here today, and maybe how to get involved and help address this issue?
Just be vocal every single opportunity that you have. Just please share your own experience, how you got the vaccine, how you felt really safe, that you know that the vaccine is effective, that the side effect that you may have had was really minor. So that's the reason why you got the vaccine. So just share your experience, because there are too many negative experiences out there in social media, and people just get hung on them. So, and it's really frustrating knowing that half of our population in the US already got vaccinated, and really the side effects of the vaccine are nothing in comparison with COVID does to you.
Yeah, absolutely. I was just talking to my mom, who has a friend who got COVID and will not get the vaccine because he doesn't want to take time off of work. The side effects could be that he can hardly do his job, which is a very physical labor job, because of the side effects of COVID. And he says, well, I'm vaccinated because I had COVID. Well, they don't even know how long that lasts. You could catch it again, and it could be worse. So this misinformation is really, it's something that we have to do something about.
Yes,
you know?
And that's what we're trying to do. So we're trying to really fight and really meet people where they are.
Yeah.
That's the reason why we're here today, to really be sure that they have the right information and the options. They need to know what they have available. The vaccine is available in so many places. We just wanted to be sure that they know that information.
Absolutely. So you say about 20% of the folks here are currently vaccinated?
25%.
25%. Why is that so low, do you think?
That's what we're trying to figure out today too. So we're trying to have conversations to figure out. What I'm hearing up to now is people wanted to wait because they were concerned about the side effects of the vaccine. The vaccine was manufactured too fast, so we don't have enough information. So we're trying to really emphasize that the vaccine is safe, it's effective, and we do have more than enough safety information available to make the right decision and say yes to the vaccine.
Absolutely. Well, great. I'm interested to see how this outreach effort impacts this, and if we can get that rate up.
Yes.
So thank you so much, Dr. Bodell, for speaking with me today.
No, thank you, Dom, and thank you for all your help.
Both Dr. Bodell and Teresa Bendito have been guests on Common Sense before, and even before vaccines were available, Teresa expressed her concern that vaccine equity would be an issue. If you'd like to go back and watch that interview from January, you can find it on NCWLIFE.com. The episode's title is All God's Children. Not only has Dr. Bodell been a guest on the show before, she's also a fellow Rotarian, and she and her husband Patrick are in my club, Wenatchee Confluence Rotary. So I've had the opportunity to get to know Dr. Bodell and learn about her expertise and background at Johns Hopkins, one of the premier medical facilities and research institutes in the country, as well as the world. She's the real deal, and we're lucky to have her doing this important work in our community, because it doesn't matter what folks' ethnic makeup, education level, or economic status is. More vaccinated people means the end of the pandemic is closer, period. I would like to thank Beatriz, Teresa, and Dr. Bodell for joining me for this episode. I'd also like to thank all the folks who have reached out to me or approached me in public over the last few weeks to express their appreciation for what I'm doing here on Common Sense. It means a lot to hear support from the people you respect. So thank you to everyone who has gotten in touch. Join me next time as I head to East Wenatchee to talk with James and Cody, who are both in recovery from serious addictions and using the second chance they've been given by their boss, Christina, to re-enter the fold of society and make a better future for themselves and their families. That's next time on Common Sense. I'm Dominick Bonny, and I'll see you next week.
At D.A. Davidson in Wenatchee, they believe your investment success begins with a personalized plan. A plan that is the roadmap you need to navigate your way to living your best years in retirement. D.A. Davidson can help you create a plan so you can take the time to enjoy the finer things in life. Let the financial advisors at D.A. Davidson help chart your retirement future today.
Flooring is the foundation of decorating. It sets the tone for your home and reflects your lifestyle. At Apple Valley Floors to Go, their goal is to help you make that choice a great experience. You'll find extensive flooring options at their beautiful East Wenatchee showroom. Engineered hardwoods, laminates, vinyl planks, carpeting. Do it yourself or have their professional installation team do the work for you. Family owned and operated in East Wenatchee.
Hi folks, welcome to Save Mart. How can we help you today?
We're looking for a recliner.
Okay, right this way. Go ahead and move this chase on the other side. You can lift this up.
Great, I want that one. I would like that one.
That's a great choice.
And I want this one as well.
Okay.
And I definitely want this one.
You'll find it at Save Mart. Full service at